I want to return to the theme of making up the lost ground for non-COVID patients within the health service. Understandable as the singular focus on COVID is, a knock-on effect has undoubtedly been for those who had procedures, screenings, testing cancelled, that there is now increased risk, particularly for cancer patients, of accelerated death. So I'd like the Minister to give more detail as to how he's going to make up the lost ground for those people, because at the end of this, cancer patients are still going to be cancer patients, and yet they have missed tests, they have missed treatments, they have missed screenings. We really do need to know how and when and with what expedition that ground is going to be made up.
Minister?
And look, I can't give the member an exact timeline or date today, and I don't think he'd expect me to, because it's about the re-engagement plan that we're looking at, and what that will mean. And I'll be blunt with members, is that when we always expected, your closest hospital to be where your procedure would be, when we start to re-engage services, members or people who need treatment, who need operations, may have to and will have to travel to central locations. As the conversation I had yesterday with the Royal College of Surgeons, when there was this perception that's out there that we'd have COVID hospitals and non-COVID hospitals, what the Royal College of Surgeons were saying was there will be no such thing as a non-COVID hospital, because there's no way you can guarantee that. There may be COVID-neutral facilities where we start to re-engage our surgeries and our screening and those procedures as well. But what I will ask the member to reflect on as well, when I took over this post, we had the worst waiting lists across these islands. They've got worse. So the actions that we need to take will have to involve the independent sector. They'll involve running our hospitals to a capacity when we have the capacity to use. Because one of the things that we can't risk at the same time is re-engaging too many procedures, too many services too quickly, so that if we do get hit by an unforeseen second surge, that we're not able to cope with those people presenting with COVID-19. So I'll give the member the reassurances as the piece of work that is ongoing centrally within my department as well, in regards to re-establishing those services, but it has to be where we do it as well as when we do it as well, because we will have to be. There can be no sacred cows, I think, when we re-engage some of the services where we look at where we actually do it and how we actually do it.
Mr. Allister for supplementary.
On a different theme, what advice does the Minister have on the issue of the general public when out and about wearing masks? Is that desirable? Is that suggested? Or is that something that is dismissed? Because certainly I've had a number of constituents asking me, should they or shouldn't they? So I'd like to hear from the Health Minister, should they or shouldn't they?
Minister?
And I thank the member, and I know it was recently raised by the Scottish First Minister. At this current time, we're weighing up the scientific advice as to the benefit it could bring or will bring. One of the concerns that I do have in regards to wearing cloth face masks is actually that it may lead to a perception that by simply wearing a cloth face mask, that some of the other precautions, the social distancing, the good hand hygiene, are no longer necessary, or those actions start to actually become less of a priority, so that the wearing a cloth face mask gives somebody a sense of immunity that it actually doesn't entail. So the wearing of the cloth face mask, we're still waiting on that scientific advice coming back. But what I would say to members is, while wearing cloth face masks, we're looking at the scientific advice. What I would also plead and also ask people, if they do think that wearing a face mask is of benefit to them, don't look to the medical supplies. Don't look to the supplies that are already being utilised by our healthcare workers, by our domiciliary care workers to simply wear when you're out and about doing your shopping or going on your daily walk. Make sure that medical grade PPE is there for the people who actually need it and actually who utilise it in the right space at the right time.